All right. So hydrotherapy, we can use aquatic physical therapy. So that's using therapeutic exercise in water. What's nice about that and what happens most of the time is there's multiple patients at once for that. So that can be great because you get a lot of community type atmosphere with it. Patients cheering each other on. That's pretty fun. Or we could use whirlpools. Whirlpools, tough to have more than one person in at a time. Big whirlpool, small patients. Maybe we could pull that off. Larry, did you meet John? You two jump in. You'll get to know each other. A lot of variety of sizes, better tolerated for patients with water phobias. So we're not submerging the patient. So that can be beneficial if we need. Some indications, well, to decrease pain and edema, right? So especially if we can control the temperature of the water, then that's going to be really beneficial. Increase range of motion, restore mobility, increase strength, increase circulation, decrease contractures, soften scar tissue. If we're talking about the exercise portion, decrease load on weight-bearing joints. We can also stimulate the vestibular system, promote some wound healing potentially, and promotes relaxation. What I don't like about how I've broken things down and the textbook's broken things down is we're talking about kind of therapeutic exercise in water, aqua therapy, lumping it the same as hydrotherapy, which is sticking a limb in a water tank. So there's, for sticking just my foot in a whirlpool, I'm not really going to be decreasing my load on a weight-bearing joint. I'm not putting any load on the weight-bearing joint. So there's some confusion with that stuff. So some indications that we have. So whirlpools versus aquatic therapies. So neuromuscular disorders, probably not great for whirlpools, no indication for it, but could be good for aquatic. Again, do exercise in water, aquatic therapies. Musculoskeletal disorders, good for both. Cardiovascular disorders, fine for aquatics. Pulmonary, integumentary, better for whirlpools. So that's the big one for whirlpools. Contraindications, again, each one has slightly different. So edema, lethargy, unresponsiveness. Which modality be like, geez, they're not responding. Try the ice massage. Like, I don't know if that would really be it, but anyway. Maceration, that's the, anybody ever have, when my son takes his bath at the end of the day, his fingers, his hands get all pruny, right? So that's what that is. Fever, compromised cardiopulmonary system, acute phlebitis, renal failure, dry gangrene, and incontinence. So some of the physical properties we'll be talking about: buoyancy, the center of buoyancy, not really a physical property of water, but something we'll talk about. Hydrostatic pressure, what is the pressure that the water places on the body? Specific gravity, viscosity, and resistance, specific heat, and then just hydromechanics of water itself. So buoyancy is the force that works in the opposite direction of gravity. This is the number one reason why exercise in water, in aquatic therapy, in a pool, can be really beneficial for some of our patients, because we're decreasing the amount of compression on their joints because the buoyancy of the water is going against gravity. The amount of weightlessness put on the body depends on the percentage of body that's below the surface of the water. So how much of the person is submerged in the water. So it's 50% decrease in weight bearing at waist high water. If we go up to chest high, there's really only about 25% weight bearing in the body, in the weight bearing joints. And if we go all the way up to neck high, it's only about 10%. So if my patient's got that terrible arthritic hip, arthritic knee, arthritic ankles, but they're not a surgical candidate, then this is an opportunity for them to de-weight themselves, but also work through improving range of motion, controlling edema, doing some exercise where they weren't able to beforehand. So, I had a patient recently, he's 400 pounds and he has a couple different blood infections that he's had recently. He's not going to be a surgical candidate for a long, long time. So doing aquatic therapy, man, if that can jumpstart not only getting his terribly arthritic hip, if that can get that thing moving a little bit better with decreased pain at the same time, then that's going to be really good for him, translate to better on land function, and potentially kickstart him to losing some weight and becoming a more attractive surgical candidate. So that can be really beneficial for him. Center of buoyancy is just a term. So center of gravity, it's center of gravity, but in the water. Center of buoyancy is a little bit higher than the center of gravity. What's our center of gravity or our center of mass used interchangeably? Right around our belly button. Yeah. Yep. So the center of buoyancy is just a little bit higher because we have lungs. So the lungs are filled up with air and make us float a little bit longer. So that's just something you might come across in discussion. It's not going to show up on any exams for my class. And I don't believe it'll be on any licensure exam, but a term that you might hear. An important thing to consider is the hydrostatic pressure of water. It's the amount of pressure exerted by water on the immersed object. So what we will use this for is it's because it can help control inflammation, assist in venous pressure return, decrease in heart rate, and centralizes peripheral blood flow, forces it back sent towards the center. And again, it'll be proportional to the depth of immersion. So if I've got a really swollen ankle, if I put my ankle in a little bit of water, the pressure that the water is putting on, that's compression. It's just like putting an ACE wrap on. If I put it in really deeper in the water, that's even more pressure for it. So that is one really big benefit for some of our patients. Again, not something I really will bug you a lot in this class, but it's a principle about water that we should know. Specific gravity is the weight of a particular substance compared to the weight of equal volume of water. Water is 1.0, human body is just under that. So if you're less than 1, you're going to float. If you're greater than 1, you're going to sink. So that's more of a physics of water thing to put in the back of your head than anything I need you to worry about. It's the specific gravity of the weight of the object compared to the weight of the same volume of water. Not poundage, but yeah, similar. Yeah. That's good way to think of it. Yes, sorry. If anybody makes their own wine or beers or anything like that, you can look at specific gravity and that tells you how much alcohol versus water content there is. So viscosity, this is something that is an important consideration for us as we perform exercise in water. Viscosity measures the frictional resistance. So water is higher viscosity than oil. It is how thick is the liquid that we're using. If anybody's changed their own oil in their car, then that viscosity of the oil is something to look at. Just how thick is that water? So if we were to take honey and dump it upside down in their jar, what's going to happen to the honey? It's going to slowly escape, right? What if we did that with water? Quickly escape, right? So that's high viscosity versus low, or low viscosity versus high. So resistance is created by viscosity and proportional to the velocity of movement. So if we had a big tub of honey, where's Pooh Bear when you need him? If we had a big tub of honey, how would we do walking in that big tub of honey? It'd be really tough, right? Because there's the thickness of that substance is really tough to go through versus water. Water would be a lot easier than honey. But even when we don't have tubs of honey in therapy. But so we are going to do exercise in water. the amount of resistance that that water places upon the person doing exercise relates to the amount of speed in it. Anybody ever try to walk in water? Not that bad, right? I mean, it's how about run in water? Way tougher, right? I mean, it's exponentially more difficult to run in water than to. Why? Because we're increasing the speed, and because of that increase in speed, it's going to increase the resistance placed upon whoever's exercising. So when we do aquatic therapy with our patients, if they're having trouble, one way we always talk about with exercise, increasing or decreasing resistance. How do we make this exercise harder? How do we make it easier? Well, one way in water is to change the speed of contraction. If it's the exercise is easy for our patient, have them go faster. Well, faster is going to create more resistance and going to require more muscle power from the patient. If they're really struggling, have them go slower. We can also change our lever arms. We could also, what would happen if we added paddles to our hands as we're doing arm exercises in the water? It's going to be harder because we're going through more substance, more water. We have to push that water around. Specific heat, again, more. There's one little consideration, but there's more physics thing than it is, but there's one application of it. The amount of heat required to raise the temperature of 1 gram of substance, 1 degree Celsius. There's going to be more heat loss in water than in air of the same temperature. If we have 70-degree water and 70-degree air, there's going to be more heat loss in water than in air. Anybody ever, I'm sure you've probably experienced that, where the water temperature is the same as the air temperature, but yet the water feels colder. The thermometer says the same thing, but the water feels colder, right? So cooler water going to be better, more beneficial for longer exercise sessions, again, because we're going to be losing more heat with exercise in water. The cooler temperature will help with that. But also conditions like multiple sclerosis, you'll learn more about in patho. The cooler the temperature, the better for specific conditions like multiple sclerosis. Warmer water, good for short duration exercise. We could do some manual treatments with water. I don't know of any. I can ask a friend who does a lot of aquatic therapy, or with conditions like osteoarthritis, where we'd want to increase the tissue temperature, increase circulation. The warmer water would be better for that. Really tough when we are renting out the YMCA to do our aquatic therapy. If you're the clinic that does aquatic therapy, you rent out the YMCA. Well, with somebody with MS, would they benefit from aquatic therapy? Yeah, definitely. How about somebody with osteoarthritis? Yeah, definitely. Do we get to control the temperature of water at the YMCA? No. So that is a really tough thing to do. And how easy is it to change temperature of a pool? It takes a long time, right? So if our morning patient needed cold water and an afternoon patient needed warm water, would we be able to accommodate that? Not really, no. So it can be really difficult. That's a challenge for us. So warmer water might be inappropriate for more of our obese patients because the adipose tissue limits heat exchange, and we could be overheating that patient significantly. So we need to be careful with that. Some hydromechanic stuff. So again, movement through water. Turbulence is a product of several forces acting on a water, on an object, immersed in water. So turbulence is the product of several forces acting on an object immersed in water. Forces include the frontal resistance, that's the initial resistance, laminar flow, that's the lateral flow of the water, and then the drag, the resistance the body creates. If we think of the drag, if we think of a boat with a rowboat has a pointed front and a flat back to it, right? So the amount of drag will, by having a pointed front, that drag is reduced, versus if we were to paddle the other way with the front end, how would that be? A lot more drag to it. So, we could look at different types, like if you look at racing canoes versus like just regular canoes. They're shaped a lot differently because of that. So again, these are different things to think about when we're talking about our aquatic therapies. Is this exercise good? What direction do we want to face our patients? Should we face this way versus that way? All of this stuff matters. So just like when we talked about with hot packs and cold packs, when we say there's so much to consider. Yeah, because anybody can, we're getting paid to do this stuff. Anybody can say, hey, aquatic exercise, come on over here. But we're getting paid to think of everything else with it. So considerations for us. Another thing to consider, our energy requirements are 33 to 42% higher in water when we're exercising in water than on land. So if I walk for 10 minutes on land, how am I going to do walking in water? Yeah, roughly. Yeah. Somewhere that math somewhere breaks down. Yeah. Between 4 and 6 minutes. Yeah. Yep. Yeah. So a lot harder to exercise in water. And that, I got to tell you, that's one of the things when we're on land. I don't know if you have any experience with this too, but when we're on land watching people exercise in the water, anybody ever watch like an aquatic, you go to those are the grandma's exercise class over there. Everything looks really simple, right? But then when you're actually doing it, what does it feel like when we're doing it?
That's hard, yeah. I mean, the sessions were only like 25 minutes, not even short like a normal PT session. Because you wouldn't feel like you did that much, but you'd be I was very tired over that. Yeah. When you go swimming at the next holiday, the next day, you're like, wow.
Yeah. Yep.
Yeah, so definitely.
So if we can control it, if we're going to do some pool exercise, between 80 and 90 degrees Fahrenheit would be our therapeutic exercise levels. Lower ends of the spectrum for our conditions like multiple sclerosis, higher ends for conditions like OA. When we are going to be using whirlpool, now with the whirlpool, we have a smaller body of water. It's in a tank. We have a lot better control of that water temperature. So we'd want 92 degrees if we have circulatory disorders, or if we want to use manual techniques for relaxation, 94 degrees for open wounds and debridement, and 100 degrees for things like arthritis, or if we want to improve range of motion. So a few considerations where we're doing aquatic exercise: increasing the depth increases the buoyancy, decreases the amount of weight bearing. The speed of movement against the water increases the resistance of the water. We can also use other things like buoyancy devices to increase resistance, buoyancy devices, paddles. You guys ever see did you use any of the, they look like dumbbells. They're just little styrofoam. Yeah, yeah. It's, anybody ever see those? They're really fun. They're like, you look at them, you go, who is you? What is this for? Who's playing the joke? Right. But once you submerge them in water, it changes the mechanics of everything significantly. Oxygen demand is higher on water than the same exercise in land, like we just talked about. There are different specific methods of exercise that you guys can look at on your own. I'd like you to know of some of the programs, but you don't have to know all of the intrinsics with it. So I do have some links to videos later on about that. Van Rags uses flotation rings. Halwick has a 10-point program using balance and control. What I like about the Halwick program is it does have like a progression aligned with it. So that's nice. And then Watsu is massage and stretching in water. Looking at different types of whirlpools, there are 4 types of whirlpools that I'll need you to know about, and they will show up on exams, and they're going to show up on your licensure exams too. So knowing the terms of them, why would we use them? What if we had all 4 types of tanks? Which one would I use for this patient? So we have extremity tanks, low boys, high boys, and Hubbards. Here's some extremity whirlpools. This is what we have back there, Tony, right? We have an extremity whirlpool like this.
Yes.
So Yep. Yep. So what's nice is we got to, smaller body of water than obviously a pool. Big enough though, so if your 12 o'clock patient needs a whirlpool, you got to start prepping it ahead of time because it does take some time. But what's nice is it also has these turbines that create the current, and that can be really beneficial either to debride wounds, provide a mechanical stimulus. What would that mechanical stimulus be doing for our patient? Number one thing, non-painful stimulus. Yep. So that is nice. We can if we're treating the wound. If we're treating somebody's ankle sprain and then they get a wound, I don't in my outpatient clinic because I need everything. I need to protect the integrity of that, and not only of the wound, but also of my equipment. So, but that's more of a hospital type setting. The use of whirlpools for wounds is more of a hospital type setting. Bring the lady down to the whirlpool room to breed her wound with the whirlpool. We have our low boy. Larger parts of the extremities can be using this, but also the big one, it's tough to tell on this, but it's really long. It's short and long, so somebody can long sit in it. That's really nice. If we have a low boy, we also have a high boy. What do you think the difference is? Yeah, bigger, taller. Yep. What I like on this is you can also see the thermometer gauge on this. So that's a nice little feature to try to give you an appropriate. And then full body immersion would be a Hubbard tank. No, we could be sitting in that. Yep. But what so the question was for the high boy, what do we use that for? More depth of immersion. What's the downside of the high boy versus the low boy? More water is the big one. Yeah, it's going to take me more time to fill this up. Yeah, that's the big one. You don't have to. No. But you might not be able to be long sit versus the low boy.
Does it have like a seat inside?
Not usually. Sometimes I guess we could throw one in there as long as it's not going to fall apart being submerged. Yeah. Let's see. So if we are going to use this for wound care, again, when we're doing wound care, it's mostly hospital based that we're going to be doing in. Part of the treatment is PT is going to bring the patient to the whirlpool room and get them in the tank. Just quickly looking at even this Hubbard tank, patient who has a wound, solid mobility or impaired mobility. How do you think we're going to do getting it? How many people looks at this and thinks like, oh, yeah, I could get in that? It'd be challenging, right? So usually there's different Hoyer lifts with waterproof slings that they use to help transfer the patients. Again, it's a lot of time to get someone in this. It's a lot of time to 1, clean it, 2, fill it, 3, get the patient in it, 4, a lot of time. Once they're in there, guess what? You're going to stay in there. I did all this work. You are sitting in that. But then we need to, spend time debriding that wound. And then we've got to get them out. We've got to get patient dried. But then we also have to drain, clean, and prepare this for the next person. It's a lot of time. So they exist. And this is one of those a few times in your career. If you're the inpatient, if you like working at inpatient and you're in that hospital, there'll be a few times a year where you're going to use this. But it's for the people where nothing else is working. I can't believe it's going to be one of those you'll never believe what I had to do today type of a thing. Like, because the amount of labor that it takes to prepare and then clean after is just, it's a lot. Huge wounds. Huge wounds, yeah, that's just not healing. Something else, like all other measures aren't working, and we just need like something else. Yeah. Potentially, I'd have to know more about the patient, but yeah. All right, so for wound care between 92 and 94 degrees, we can also use we have to use antibacterial disinfectant agents to sterilize anything that's going to be in contact with the water, the whirlpool itself, the tank, the turbine, anything that comes in contact. Each facility has its own cleaning and sterilization procedure. And cultures are taken periodically just to make sure it is clean. So it's not just us cleaning it and then saying, yeah, it's good enough. No, somebody comes in and also tests it as well. Some indications for hydrotherapy with wound care. Well, if we need to debride, if we need to clean, if we need to hydrate, if we wanted to improve circulatory stimulation, or because those turbines, that turbulence creates that non-painful stimulus, we can help with pain with that as well. So that is nice. Contraindications. I think we talked about this. What was it? It was the same as pulse lavage, right? So split thickness grafts, less than 5 days, full thickness, less than 10 days. That's the same for our pulsatile lavage, right? Full body immersions, if vital capacity is less than 1,500 milliliters, when you in pathophysiology, when you get to the respiratory section, we'll look at what that means, that vital capacity, but that's a measure of how much air can the lungs hold. The reason why we would, it's a contraindication is because the water, if it's exerting pressure against the lungs and I can't expand my lungs, if I'm already impaired, now you're giving me more restriction for it, that's not going to go well. IV lines or colonostomies. Precautions healing wounds with granulation tissues, edematous extremities, sensitivity to the additives in water. If they have a catheter, seizure disorder, or tracheostomy. Obviously, always assess your wounds, measure it, describe it, measure it. We can look at some wound sterile techniques. You can watch that video if you want. Aquatic therapy, safety, basic safety. Is there additional help around? Is there a lifeguard on duty or are you it? Make sure you review your precautions and contraindications to it. If you're going to perform deep water exercise, patient's feet don't touch the bottom. So we not need the water depth to be taller than the patient. So 5 to 6 feet. We could do open chain kinetic exercises. We could also use buoyancy assisted devices if that person just needs help stabilization. You know, we could put them in the deep end with flotation device and now they can do open kinetic chain with their legs. Mid-level, we can start doing closed kinetic chain exercises. We can progress them from, chest high to waist high water if we wanted to progress the weight bearing ability of it. That's nice. And then to document, we want to include any sort of any equipment that we use, whether it's be buoyancy assisted devices or those weight machines, temperature of the water if we need to. Here's some videos of the band rags techniques. These SwimX are pretty cool. Let's see if we can find a quick picture. There's a good one. So these SwimX pools, they're really small pools. They're a bunch of different versions of them, but they're usually deep. And what they have is there's a current that we get to control. So we can have the current say, okay, I want the jets to push at 1 mile an hour, it's 5 miles an hour, 6 miles an hour. And you can do full swim as fast as you possibly can against it. It's a treadmill for water. That's all it is. So it's pretty cool. URI has one in their physical therapy department. Smaller body of water, so we can control the temperature a little bit better than the big YMCA pools, but it's still really tough. But there's a bunch of things you can do with that. That's pretty fun. And we also have, if you wanted to watch, pediatric aquatic therapy. That's where I see a lot of aquatic therapy is in the pediatric world. I know at Hasbro, they have a pool in their building, their outpatient building. That's pretty great. All right. Any questions on aquatic therapy? All right. So we've got a half an hour left. What I'd like to do is start knocking out some skill comps. Okay. I got to sign yours, Isaiah. Don't let me forget.